All right, so again, my name is Stuart Schlossman. Thank you very much for joining us. I am president and founder of MS Views and News. I am saying, hey, everybody out there. All right, and again, this program tonight is a virtual event, like you know. It is a Compass to MS Care program where we were doing these in many rural areas and suburban areas around the United States last year. I think we did 40 of these types of programs in these areas. All right, after Dr. Janicki, Jeff Segal is here, and Jeff is an MS exercise specialist, okay? And Jeff will be speaking with you all after Dr. Janicki's talk and after his Q&A. Jeff will speak for about 30 minutes, and then we'll have another 30 minutes of questions and answers. All right, before we begin, though, I want to let you know that tonight's program, as you can see, we're doing this program with support from Bristol-Myers Squibb, Genentech, Novartis, and Sanofi. And I can't hear everybody for them to say thank you, but I'll say thank you for you all right? Thank you very much to our supporters. How are you, Jeff Segal?
Hi, how are you doing?
Jeff Segal is an MS exercise specialist, and Jeff is going to introduce himself tonight, all right? But I just want to say that Jeff has worked with many MS patients and has helped many people excel to get to a better curve of their own in helping them to strengthen what they need to and to reduce pain from spasticity and other things as well. So I'm going to let Jeff take over, and Jeff's going to speak for about 30 minutes. And after he speaks for his 30 minutes, we will then come back, and we also have several pages of questions to speak with Jeff about as well. Okay, so I'm going to let Jeff talk. There you go, Jeff. Take it away. Nobody can hear you.
All right, you can hear me.
There you go. I know you.
This is really strange to do a talk like this, but this is the new norm, I guess, because this is how our athletes are going to perform. All the sports
Right.
with crowds with no fans. I thrive on the response of the crowd, and I figure out what I'm going to say next based on the response of my last statement. But it's really weird, and times are weird, and sometimes I wonder if I'm ever going to be caught in a traffic jam again. MS and exercise, it is a must. And I know there was already a question asked about, will MS slow down progression? What will MS do? How will exercise help your MS? It's really about what exercise can do throughout, the longevity of your life. But not just that, you don't want MS to take anything from you. Strength is something that can be lost from two things. One, directly from MS, and secondary to that, it's from doing nothing, from being lazy or being sedentary, depressed, inactive, and that's what we all experience. And a lot of us have experienced this during this the last few months with this pandemic. I mean, a lot of people have stayed home and just not moved around, and I'm asked by so many people, what's the best exercise to do at home? And the answer is anything. The answer is anything you do is more than what you were doing, or you wouldn't be asking that question, likely. And if you don't have equipment, you come with equipment, your arms, your legs, your body, your core, everything can be used for exercise. I've become an MS exercise specialist over the years for a few reasons. One is from academics, but there's another reason, and that's that all the terms that you hear from your doctor, whether they're a long word or something you don't understand, I've had to learn these words prior to being diagnosed with MS and being an MS patient. Then, shit hit the fan. I got to feel all these symptoms and match the feelings with the words. So when I'm working with others with MS or other illnesses, I can relate to what they're going through, and I can relate to how I was able to get myself, off the ground or off the floor or out of a chair when I couldn't walk, and help others, from a different perspective. That's what I bring to the table. Unfortunately, I had to go through it to understand it, but fortunately, I can help you out. There's so many different things that happen to people with MS. And I'm happy that it was talked about how each case is so different, because when people ask me, which is the most common question I get daily, I can't remember a day that somebody has not asked me a question of what's the best exercise for MS. And there's so much that goes into that. For one, everyone's different who has MS. So for one person, I can tell you to do a single-legged squat, and they'll be able to do it because MS isn't affecting them as much, and that would be a good exercise for them. The other person might not be able to use that leg or the other leg. So I can't give you a workout based on what you're telling me. I have to see you move, and that's what workouts are about. You see, from a professional standpoint, you see what people are doing, you see their movement patterns, and if something's off with the pattern, you don't necessarily fix the pattern, but you relearn the right pattern. And that's basically what neuroplasticity is. And neuroplasticity is like the new big word with MS, because MS, people think, well, I'm stuck, I can't progress, I can't do anything more, I can't help myself. And neuroplasticity is basically getting to a dead end and not just stopping. It's going around and finding another way to go. And when you find that way, you'll know, because you're not stuck in that no man's land. So we've got a lot of questions, and there's a lot of people. I know there's a lot of viewers from all over the world listening to this, and you'll be able to watch this, which is phenomenal, because I would imagine the other side of the world, you guys are sleeping, or you're getting up and going out of your work. So I'm going to go over some of the questions that people have asked. I've changed what I'm going to do. As you can see, I'm doing this from home. I'm in my home gym, and I've got all kinds of stuff. One thing that you can see is lots of cleaners. Everything has to be sterile and clean. And when I'm working with people, I use a mask. I wear a mask because I'm protecting them. Can you hear me okay? Because if you can hear me, that's one excuse you can't use for wearing a mask, is that you can't hear somebody. Now, when I'm working with people, not only do I wear a mask, but I wear goggles, because every person that I'm working with is high risk. And if they're not high risk, I don't want to get them sick either. And by wearing a mask, you're basically saying, I care. I don't just care about myself, but I care about you, and I care about humanity, because it's a humanity issue right now. Some people don't care, and some people think that it's not real, and some people just think that it's propaganda, or that it's not, If you do think that and you don't feel you need a mask, that's your problem, and we can use you. You're very helpful to us, because you can volunteer at the hospitals where they're short on masks, and then you can tell us how unreal it is and tell us why the ICUs are full. But I'd rather you not do that. So I'm going to talk about some of the questions over the last few days. And one is, can exercise help MS from progressing? Can people who go from using a walker to a cane, can people go from a walker to a cane with exercise? Well, you're not going to do it without exercise, because in order to go from a walker to a cane, you're going to have to use more effort. More effort on a continuous basis is the same thing as exercise. Now, what MS does to you, it can make you weaker, but if you strengthen the muscles that are getting weaker, you're kind of like keeping the level of the water where it's supposed to be, and you're not allowing those peaks to come through, or you're staying just ahead of the game. It's just like anything else. If you want to do better, you gotta work a little bit harder, and it is hard. It's not easy, and I'm not going to sit here and tell you how easy it is to exercise, but I can tell you that once you start exercising, it's hard to stop, because you see results, you feel results, and other people start to compliment you, and then you got positive feedback. Yes, the answer is a person can go from a walker to a cane, and from a cane to just walking, and it's based on several different things. It's not just based on that person and how hard they work and how hard they try, or if they're a good person or not. It depends on the course of your disease activity and how it's gone. But I can tell you that if you don't work at it, you will not get any results. Another question is frozen shoulder common occurrence with MS? Well, frozen shoulder is a term that's used for a contracture, which just means that the tendon is shortened, which means when the tendon shortens, the muscle cannot lengthen the way it's supposed to, and your joint becomes not workable. So a frozen shoulder, usually you can't externally rotate it, or you can't internally rotate it. You definitely can't reach behind your back. The best way to prevent that is to use your shoulder and do full range of motion stuff, whether it's this, that, using bands. I'll show you some band exercises. But without moving your extremities lose the ability to move because of that same synapse. One of the other questions we got is how to get started with exercise. What are the best exercises to stay active? Well, with that being said, exercise and active. If you're doing exercise, it is keeping you active. So I'm not quite sure what the best exercise to keep you active is, but whatever exercises that you're doing that you're not moving a lot aren't the ones that are going to keep you active. So here's something you can do. You can find something that you enjoy doing. It can be anything from a balloon to a golf club, practicing with a golf club, throwing a balloon around, catching it. You'd be surprised. And if you've seen some of my videos, you know how much I like to use balloons. If you're sitting in a chair, I'm going to show you my chair. It's going to be my massage table. If you're sitting in this chair and a balloon's coming and you reach out this way, if you don't use your core, you're going to fall over. You're going to follow the chair. If it's going this way, it's gone. But without a core, I couldn't have moved around like that. My core muscles have to be strong. Just catching a balloon is going to help with hand-eye coordination, controlling your movements, and some strength and stamina. So I hope that answered your question. Find something fun to do. Do it at a higher intensity and for a longer period of time. And the more you do it, the more the better conditioned you'll be. Interested in leg strengthening so I can walk longer. I agree. I'm not sure if there's a question with that. There's a lot of things that you can do to strengthen your legs. When it comes to function, though, exercises that mimic the activity that you're hoping to improve on are the ones that are going to transfer. There's something called spasticity, and your body adapts to what's imposed. So there's an acronym that I like to use, SAID, S-A-I-D, specific adaptations to imposed demands. Those are basically your body's way of saying, all right, I've learned this, now I'm going to do it better. Now I'm going to do it better in real life, and here's the outcome. Let's see. When I exercise, my bones crack and crank. My low back makes noise when I move my neck. Well, that's odd. I hear a crunch sound. Any thoughts? I have PT home health coming to my house. I think you just answered the question. Yeah, a PT is very important. If they're coming to your house, it's because there's something wrong and they're going to help you fix it. But when it comes to joints cracking, and if you've met me or worked with me, you'll have heard me say this if you've complained about joints cracking. Joints crack. Joints make noise. If that noise does not hurt you, you're probably okay. What it's telling me is you got good hearing. I mean, I don't know if you can hear that. I just turn my head, move my head. I mean, I can make everything crack. It comes from just living. You know, you got tendons crossing joints and they pop and they make stuff. But if it hurts, you should get it looked at. Okay. Okay, what are your thoughts and experience with exoskeleton and robotics? I guess it's robotics for MS, e.g. Rewalk Tech, RMD, REX. That's probably coming from the Dalton mat training theory, I'm assuming. I'm not sure because it wasn't specified, but that's the myoskeleton alignment technique, and it's also another word. MAT training is muscular activation technique. Both of those they can be helpful for people with or without MS. I don't know the research and what they show as far as function. Yes, you can get more gain flexibility at the moment of using these methods, but I don't know what the carryover effect is. It's similar to PNF stretches, proprioceptive neuromuscular facilitation, and that is basically pushing against a stretch, holding it for up to 7 seconds, and then releasing it, going to a further range of motion, which is a temporary gains. But this is something that has been transferred from massage practice, not as much from physical therapy or exercise physiology. This is more of a massage technique, so that would be outside of my scope of practice to do. But I've read a lot about that stuff, and you know, there's lots of different schools of thought. What are the best exercises for someone with severe walking difficulty from PPMS, primary progressive MS? When I'm working with people who have MS, I look at MS as MS because the symptoms are similar. The course of the disease might be a little bit different, but the symptoms and the goals are what I'm working with. I'm not doing anything different with somebody that's got primary progressive, secondary progressive, or relapsing or remitting. All you're going to do is work with what you got. And if you work with what you got, you're going to work with a little bit more and a little bit more, and what you got is going to be a little bit better. That's what exercise does for everybody, whether it's an elite athlete or whether it's just somebody off of the street. You have the ability to do a little bit more, and that little bit more will go a long way. So back to that question of the best exercise for someone with severe walking difficulty, see a physical therapist. I don't know what the severe walking difficulty is, but if you can't walk at all, you've got a lot of other things that you can do, and those are what you should be focusing on, and let the professionals focus on your walking ability. You've got an arm, 2 arms, 2 legs, a bunch of fingers. You've got a lot of body parts that can move. And if your legs aren't moving how you want them to, and you're thinking about that enough to stop you from doing other things, then you're holding yourself back from, well, you know, what your abilities really are. We work with what we have. We don't work with what we don't have. Let's see. Need help with strength in my muscles. Amen. Well, the only way to strengthen your muscles is to use your muscles. And with resistance exercise, there's really 3 types of strength. There's power. There's there's power, and you've got conditioning, and I'm thinking more of the rep ranges, and then there's strength. And the power, to get power, you're going to go between 1 and 2 reps of the very most that you can do, which is not that, it's not indicated for people with MS. But the rep range for someone to increase strength is, you know, above that 2nd rep, anywhere from 3 to about 6 reps to failure. That means the last rep, you're going and you can barely get it up, but the next one would definitely fail, or someone helped you finish it. That's the most important part of the exercise, is the very last part of the exercise that you couldn't do or that you just were able to get done. And then comes the conditioning part of exercise, or hypertrophy, which is fighting atrophy. And that's in a rep range of 8 to 12 to 15 reps to failure, and multiple sets, and that's going to build more size. But you got to switch it up so you don't get to a plateau. You can't keep the same workout and keep going on and on and on and expect it to work. And you, as an MS patient, if you're looking to increase function, the muscle size isn't the important thing. It's the muscle's ability and what you can do with that muscle. So if you want to be a bodybuilder, that's functional to you. Your muscles are going to get bigger, but your function of the muscles may not improve. In fact, some bodybuilders have less flexibility because see how hard it is for a big bodybuilder to reach across their body and grab a seatbelt. It's not that easy. Need help with strength of muscle. Okay, what lower ab exercise? I'm going to stop right there. There is no lower ab exercise, upper ab exercise. You can change the insertion and the origin of the muscle by which way you move the muscle. So if you're doing a crunch, your abs are basically coming from the top down and pulling you down. But if you lift your legs up, then your abs are working from the bottom up. The origin and the insertion flip. I'm not sure what the question really is asking as far as, let's see. They want more tone and they don't want to strain their lower back. Well, if they don't want to strain their lower back and they're predicting strain, then it's probably a good time to start strengthening your lower back. Anything where you're moving in a resistance against something backwards is going to work your lower back. And I'm going to show you a couple things. I'm going to get back to that, but I'm going to show you some things with some bands that you can do. But something as simple as sitting up in a chair. If you're sitting straight up in a chair, if you lean forward and back, you're working your lower back, and from a seated position, it's not going to put too much pressure on your back. Abs is going the other direction. I don't like to isolate abs. It's not something that's very important to me from a functional standpoint. Your abs are working with every exercise you're doing, and if you can control them and keep them tight when you're doing stuff, you have a little bit more protection from injuries. So if you do have some straining in your lower back while you're doing an ab exercise, you should get your lower back checked and find some exercise specific to you and your specific issues with your lower back that will help and not hurt. Best at-home stretch for lower back spasm. Well, that depends on the person as well, but I am going to do a series of stretches, and I'm going to identify which stretch is going to go with which problem or what kind of solutions can come from them. What exercises can I do while riding a long ride in a vehicle? Tell you anything when you stop that vehicle. If you drink enough water when you're driving, you will be forced to pull over and get out of the car and move around and use the restroom, and that's a good way to loosen up. If you're in a car as a passenger, I mean, you should stop your car every so often, just to stretch, loosen up, walk if you can walk, stretch your arms up, move your body around, whatever it takes for you to get out of that car, put your feet on the ground, even if you can't stand up, do it. That's going to loosen you up in a long trip. And so is drinking water, because you got to pull over to use the restroom. Let's see. I'm interested in stretching and strengthening. When you have a lot of spasticity, how long should you hold each stretch? Okay, each stretch, I don't hold any stretch for less than 15 seconds. Some stretches I get into the minute, 2 minutes, but I don't go too far past that. The problem with spasticity is, what's causing it? Is your spasticity due to your MS? Is it due to having electrolyte imbalance? Are you dehydrated? I mean, let's figure out why you're having spasms first. If your muscles cramp up and that's the type of spasticity you have, you don't want to keep the muscles pulling. You want to straighten them out. So if your toes curl up and you get a cramp in your calf, first off, while you're sleeping, don't tuck your sheets in, because that'll make it worse. Get something to pull on your foot and straighten your leg out. Do not bend your leg, because it'll go from your calf and it'll go all the way up into your hamstring, which is the back of your leg, and then it can actually go into your lower back. I will show you some stretches that help that. Activity strengthening is the best way to gain flexibility, because when you're doing activity and you're strengthening, you're increasing your range of motion and you're working on flexibility just by using your muscles. I'm interested. Please describe exercises to do at home with and without equipment. Okay, I will do that. I will talk about body weight exercises. Well, first off, knowing what your body's capable of doing is very important when you're exercising. If you want to stretch your bicep, don't keep your bicep bent all the time. Straighten it. Here's a bicep stretch, just putting your thumb down and reaching your arm behind your back. You should feel that right up your bicep. The tricep is the opposite muscle. When you get spasticity, if it's muscular co-contraction, what's happening is your brain signals getting crossed, or something's not getting to the area that you're trying to use, and both the agonist and the antagonist muscles contract at the same time. Bicep being the agonist if you're doing a curl, and the tricep being the antagonist. So if they both contract at the same time, then nothing's going to happen, and that's going to cause spasticity. That could happen in your lower back, that can happen in your legs, your hamstrings, even your quads, although your quads are not as likely to cramp up as your hamstrings, because unfortunately most of us sit on our ass all days and our knees are bent and we're in a flex position. That's the sad part of it. And our hamstrings are shortened, so when we do straighten them out, they don't know what to do and they get excited and the muscles spasm, and then the two of them fight each other. Quadriceps stronger because there's 4 rather than 3 in the back, but it's not a battle you want to have. I'm interested. Just please describe exercise at home. Okay, I'll do that shortly. Exercise while sitting, I'll do that. Be specific on stretching, strengthening. How to do properly. I'll get into the techniques of stretching and how to do it. One thing that I am going to tell you guys is stretching should not be done to tight muscles. I understand if you're getting into a cramp and you want to stretch the muscle out to prevent the cramp, that's a little bit different. But if you want to hold a static stretch on a muscle, you should warm that muscle up by movement or passively. And passively warming a muscle up can be something like a warm shower, something warm on that specific spot that you want to stretch. And that's not going to be central. That's not going to cause your core temperature to rise and increase problems or possible symptoms from occurring. So loosen that area up, then stretch. If you don't, then you're basically taking a rubber band, putting it in the freezer, pulling it out and trying to make it longer. What's going to happen? It's going to either snap or it's going to stay long and it's not going to shorten properly. So exercise, and I'm going to get back to some of these questions. Exercise starts a whole process in your brain at the molecular level. And for these things to happen and things to be created, we can create things in the brain like growth factor, neurotropic growth factor, which is major because that helps with neuroplasticity and helps broaden the mind. And if you're having problems with memory, that's something that is key. And it's been proven with not just with MS patients, with Parkinson's patients, and with all sorts of other neurological illnesses. They've identified the growth factor being a major contributing thing to helping out people. Almost as strong as a medicine. In some illnesses, it's stronger and more beneficial than any medicine that's out there. But the key is don't pick one or the other. If you got two things that are helping you, use them both. If you're taking a medicine to slow down the progression of an illness, slowing down your body more so than it needs to slow down is not going to help you. What you need to do is the most you possibly can. Be the best you possibly can, and you'll be more of a participant than a spectator in life, and that's what we want to be. We want to be participants. Okay, this one is interesting. Exercising is very important, but how does a caregiver convince someone with MS of the importance of exercise on a regular basis? Well, give them my phone number. And if they're not willing to talk to me, then you're not going to get through to them. They should be listening to this. And if they are, I can tell you this. Life is a lot better when you're not out of breath. Life is a lot more fun when you can do rather than watch. And if that's not enough for you, you have nothing to complain about because you don't want to do anything for yourself. But the best things in life are things that we accomplish and then we see results. Set goals. And one thing that caregivers forget to do, and it really is pathetic, is they end up telling people what to do, but they don't do it themselves. So if you really want that person to do more than they're doing, so do you. You got to do a little bit more and do it with them. And you know what? Show them how easy it is. If it's time to do their exercise, it's not going to hurt you to exercise too. So you do the exercise, let them watch every day. Let them watch and tell them how much better you feel, and maybe that'll help. And then give them my number. I had a hip redo in February. I've been doing exercises for my hip. Now I would like to go back on the treadmill after falling off it in June. Any tips for the treadmill? If you fell off a treadmill, it might not be the best thing for you to do. However, if you fell because you weren't holding onto the rails, hold on to the rails. One thing about treadmills is they all come with a little piece that you can stick onto your shirt, and you should use that. If you don't use that, then you're subjecting yourself to injury. Once that thing is pulled, it completely stops the machine and it prevents injuries. So use it. It's important.
Hi, Jeff. Can I interrupt you for a moment?
Yeah, you did. Of course you can.
Great, thank you. So we have only about 20 minutes left, so I'm hoping that you can start doing some of the demonstrations so that way people can see, you know, what you've been telling them that you're going to show them in a moment. And
Yeah, I got 4 quick things I'm gonna read off that you gave me, and then I'll go back to doing the demonstrations.
perfect.
So,
Thank you.
best way to reduce stiffness, well, we're going to talk about that with activity and stretching. Suggestions to strengthen arms, legs, and core. Well, I just told you the rep ranges to do for whatever kind of strengthening you want. And I'll show you some exercises. Core is basically anything that you do against resistance, walking against resistance, bridges, planks. Those are great for core. Please discuss adaptations for exercise. I'll do that as well. Seated and chair exercises, laying down exercise. And what are your thoughts about exercises and weightlifting? Whoever asked that, thanks for showing up. But you just got a lot of my thoughts on it. And I'm going to show you some other things right now. I can tell you this, the best results that you're going to get from exercising, whether you have MS or not, are by doing, not by talking about it, not by putting it off, and not by telling someone else what you used to be able to do, because I can give a rat's ass what you used to be able to do if you're not doing it right now, or if you're not using the motivation that got you to do it again. So I'm going to show you some things. I'm going to get up on this table over here, and let's see how this works. And then you see all the cleaners. That's all stuff that I take with me when I'm going places, because it's a weird time right now, but I always keep it clean. And if you keep everything clean and everybody does the right thing at all times and practices proper public health, we would be out and about right now. This is a great tool. This is something that's great for spasticity or for getting out cramps. I'll show you how that works. It looks a lot like a rolling pin. A rolling pin is $2, so it's more affordable. And this is great because this is like me in my playground. So first thing I'm going to show you is, you guys wanted to know what you can do from a seated position. Well, if you can sit down, I got something here that would be like the level of the ground. Well, first off, for hip flexors, if you can do this without one stopping like that and not working, then that's a good exercise. Hip flexors are aerobic muscles, but you're not going to strengthen a hip flexor to do a longer exercise. I'm going to lay back and show you some other stretches and then some other seated exercises. This is a timer. You guys ever seen one of these in the kitchen? It's old school. You got them on your phone. But what I like to do is give these to people and set them for 30 minutes or an hour and just sit it on the table. And if it goes off, that means stand up, get up, do something, move your arms around. All right, so stretching. If you want a good lower back stretch, and remember, you should have loosened muscles, or you should have them warmed up a little bit. The typical one is going to be one leg straight, one leg bent, and holding it back. And for those of you who are very stiff and you can't grab that, they sell straps for something like that, where you can put it under your foot and pull. The other one would be both knees pulling to your chest and holding it. That keeps your lumbar flat against the ground, and it can reduce spasticity and cramping and loosen up your back. Some other stretches for your back. Well, this one is actually a hip flexor stretch, but your hip flexor, this muscle here, one of them goes all the way through and attaches to your lumbar spine, your psoas. And then that gets tightened, then you're getting pulling on your back. So a great exercise you can do at home or wherever you are is just lay down on your bed or on the couch, let your leg hang off. This leg here is stretching the hip flexor. Now, when it comes to stretching your lower back or your glutes, cross your leg, hand between your leg, pull back. If that doesn't work, you shouldn't get up like I just did. Cross your leg while you're seated and lean forward. If you can't feel this back here, then you might not be able to feel back there. So doing that same stretch that I just showed you, if you put one leg over the other, you can pull that through and do that stretch as well. Another good one is one leg like this here, put this leg, pull it over this leg, and I've got to stretch all the way up my side. As far as hamstring stretch goes, which those are muscles that get tightened up a lot right back in here. If you're my age, and I'm 30 years old, so if you've been around as long as I am, as I've been here, we were taught to do a stretch for the hamstring that was incorrect, which was like this and reaching forward. That's the hurdler stretch. The modified hurdler stretch is one leg in, one leg out, reach for the foot, and if you can't, you have a strap. You can do this. Now, there's something that's important about stretching muscles. There are tendons that do not stretch. You should not stretch tendons. So if you're doing a hamstring stretch and it's like this, you notice how my knee is slightly bent? That's so that the tendon back here does not get pain. And if you feel pain right here, then slowly bend it a little bit more, and a little bit more. You should still be able to feel the belly of the muscle. But the tendon, if you feel anything behind your knee, it's not a good idea to continue. You don't want to tear a tendon. If a tendon tears, that's what connects the muscle to the bone, and you will not be able to use that muscle anymore. You've probably heard about people tearing a bicep and it rolls up, or tearing their Achilles tendon and it rolls up their leg. That's something you don't want to have happen. And if you've got questions about safety and that type of stuff, ask them. Don't assume. Assuming what's safe and what's not safe will get you in trouble and get you hurt, and you'll be in trouble. So now I'm going to show you some other exercises. Actually, I'll show you a couple of lower back exercises, then a couple of ab exercises, and then I'll show you the stuff with the bands. So the go-to glute and back exercise is a bridge. A bridge is lifting your body up. Try to make a straight line from your knee to there and down. Now there's many variations of it. Heels up, your toes on something, pressing down. When you use your toes, you're going to get more of your gastroc and your hamstring into it. Or you can cross your leg. Now when you cross your leg into a bridge and you come up, now what's happening is I'm stretching this. I'm stretching my hip flexor, but I'm working back here. Now I'm going to move this a little bit. So if you can get on all fours, and you can lift your leg straight out behind you, that's a great core exercise, especially if you can put your arm out and hold it. Hold it for about 5 seconds, switch to the other one. That's working everything that's in my back all the way up to my shoulders. Another one is laying flat on your stomach, and just a little bit of retraction of your scapula. That's working my back. Or if you hold something, lifting your legs up. If anything causes you pain, you're doing it wrong, or you have an injury and you should not continue doing it. Well, this is some band exercise that you can do. As you see, I've got a lot of different bands. That's just a grab bar. It's secure. But anything that you can do from a bench or a seat, you can, if you're able to stand, you can do standing. This is the same thing as a bench press, except my feet are on the ground. And because my feet are on the ground, or if I was seated and doing it, I'm not going to sit on this because it won't be sturdy. If I'm seated and I'm doing that, my abs are controlling my core. So when I do a press like this, if my abs were not contracting, this is what it would look like. And I'd fall back. Same thing goes for a row. Now let me get a, if I was to do a row, I'm going to curl the bands up so you can see. If I'm standing and do a row like this, or if I'm seated, let's see. What I'm doing right now is I'm working my lower back, strengthening this, because just like what I was doing before, if I wasn't doing that, I would do this and fall forward. So I'm using my erector spinae muscles or my paraspinals to keep my body upright. Same thing goes if you were to do a band press. Now comes a fun part. Seated or standing with one arm. If you do one arm press, now I'm working my chest, but I'm also working my abs as a rotational muscle, abs of rotation. So when I'm doing this, I'm preventing the force to pull me this way, and I'm actually moving this way according to my abs. So I want to do it with each arm or from a seated position. In a seated position, the same thing. Now I'm still working my abs so it doesn't pull me back. If you want to shake it up a little bit, let your body know you're alive. If you can put your feet on the ground, put your feet on the ground. It's what your body wants. Your body needs it, and your body's going to respond, and your brain is going to respond. But if you ask your body to do something that it hasn't done in 30 years, 20 years, 10 years, and you compare yourself to that time, total failure. So you start from scratch. Develop a baseline. Try to break your record. Try to do a little better than that. Doesn't mean you have to, but it's something to aim for. And the more you do, the more you'll be able to do. And the more you're able to do, and this is what it all comes down to, the more you can participate in life. And that's what life is all about. If you have children, parents, grandchildren, grandparents, siblings, they're all rooting for you. Don't be ashamed. And the best thing that can happen is you can actually get in better shape than them and maybe set things up for them so they don't have heart disease or diabetes or other comorbidities that you're not immune to. But everybody moving is a helpful thing. And if you see others do it, follow. Do it with them. It's better to do it with somebody else. But if you have to do it alone, you're going to slowly get the results. And they're great. So is there any other questions from anybody else, Stuart?
The answer is yes, but I wasn't ready for you, so I'm coming back on. And by the way, for anybody out there that's seeing a blurry me, I can't help it. We've tried everything to make it unblurry, and it's just not working. Okay, so the other questions. All right, first off, you may want to answer that question from that person that wrote with the tendon problem. She was asking how she could strengthen her tendon. Do you have an answer for that?
Tendons are not muscles. Muscles get stronger. Tendons they stay the same strength. I mean, they can get a little bit stronger, but you go to a physical therapist, find out what it is that's caused, like anything else. You got to find out what's causing the problem, and there's a course of action to rehabilitate it and make it better. That's a very interesting question, and I know it hits home to you because you have the same problem, but as you know, it's a very painful thing, and a lot of, without surgery, there are interventions and there are braces, but you got to find someone that really knows what they're doing, or else you're going to really be messed up just like anything else.
That's right. So if that person lives in Florida, especially South Florida, I could definitely turn you on to the greatest doctor that I will now say for this issue that I have, okay? All right, next, Dorothy. I could say names now. It's just Dorothy. Dorothy would like to know how best she can relieve spasms in her body. And I know you were mentioning about not putting your legs in the sheets, but what else might you have for a person who maybe is at work during the day and is getting spasms?
I can tell you the more you move, the less it's going to happen. The body needs to respond to the movement. If your body's sedentary, you're going to get involuntary actions and they're going to cause pain. So the first and foremost, most important thing that you can do is movement and strengthening. And the stronger the muscles are and the more they respond to the actual movement that you're asking them to do, the less likely you're going to have the other muscle get involved that shouldn't.
Okay, Maria wants to know what bodybuilders can do, since most of them cannot do yoga, but wants to know what else they might be able to do for similar therapy.
I couldn't hear the first part. Her body what?
You were talking about bodybuilders cannot do yoga, Maria says. So she wants to know what her bodybuilder can do if he cannot do yoga.
I don't know why bodybuilders can't do yoga, and they can do yoga. What happens with yoga is if you do stretch your muscles too much, then you may prevent contraction and growth. But you can do yoga. And I think, Maria, you ought to do yoga, and the person that you're talking about should either do it with you or not. If it's you that wants to do yoga and bodybuild at the same time, there is a place for that.
So that leads to the next question. A person named Robin would like to know if it is safe for her to do yoga.
As long as her doctor has not told her that she should not do yoga, it should be safe. And no matter what exercise you do, you should always consult with your doctor prior to starting an exercise program. There may be something that's that you have an underlying issue that you don't remember or don't know about, but with that doctor's stamp of approval, go for it.
Thank you. There's another person that writes, what is the best way to survive the heat? And if there's any nutritional things she can do that would help that as well.
Go cold water fishing. The heat is the heat. The best way to stay out of the heat is to stay out of the heat. It's summer, so it's going to be hot outside. So if you're driving, some of the biggest problems people have is getting in their car after having a parked car out in the heat in the summer. You get into a car that's 130, 140 degrees, you're not going to feel well if you have nothing wrong with you. But if you have MS, you're probably going to feel a lot of it. And the best thing you can do is find a tree to park under. Also find somebody that can wash your car, because you park under a tree, you're going to get into a car that's nice and cool. If not cool, it's going to be easy to cool down. It's going to take a lot of time off your plate, and you're going to have a lot of bird poo on your car. So you got to find someone to clean that off too. But that's one of the most important things, is keeping cool.
Sorry to cut you off. The next person has, the pool has gotten very hot in the summertime. What can she do to cool it down? Because it doesn't seem to work with dry ice. She didn't say that. I said that.
If the pool's too hot, you're going into a hot tub, don't do it. There's not a cooling vest that I know of that's going to keep you cool in the water. So go to a pool that is in the shade. That's the only thing I can tell you. I mean, you go up north, you have cool nights, the water stays cool during the day. But if you're down here, you put your foot in the water, you might not even be able to tell it's wet, because it's the same temperature as the air.
Right.
So.
Okay, next one. I've been diagnosed, not me, but whoever wrote it. I've been diagnosed with weakness of the expiratory muscles at 25%. Can anything be done for it? And do these muscles act like other muscles that tire with use? And does this progress?
Expiratory, I don't know. I do not know the answer to that. But what it sounds like is just conduction failure. So at 25%, you're no longer able to move because the signal's no longer there. So if that is the case, it might or might not be by the wording of it, then you're better off doing interval training with rest. Upper body, rest your upper body, do lower body, rest your lower body, do upper body, or go into some other type of exercise and go back to it. It's okay. You can add it. It adds up. And remember, a little bit's a lot more than 0.
Okay, thank you for that. And the last one is, I suffer from nerve pain every day, but it's even worse at night. Is this normal?
No, it's not normal. I mean, I don't feel it. Do you feel it? 'Cause I mean, it's something that you should talk to your doctor about, because there's so many different things that it could be. And the nerve pain that you're experiencing, or whatever the pain is, could be caused by something that you didn't even know was wrong with you, or it could be something that's easily fixed. There's a lot of medicine out there for nerve pain. Neuropathic pain's not fun. There's also some other and some other things that you can do. Talk to your doctor, see what's causing it, see if they know what they can do. But neuropathic pain's unfortunate.
Okay. Thank you for everything you've done here tonight. People have been texting me and telling me what a great job Jeff is doing. And so I want to thank you, and I wanted to let everybody know that, these programs that we are doing, we are archiving them. We're putting them onto our YouTube channel. Okay, so in a few days from now, we'll be able to send out an email to each of you that registered to be on tonight's program. We'll let you know that it has been published to our YouTube channel. We'll give you the links to get in there. Dr. Janicki's talk will be separated from Jeff's talk, okay? And we hope that you could use it going forward. Please also know that we have MS Neuro TV once a month. You can find that by visiting our website, www.msvn.org, or you can just, read the newsletters. It's there as well. We also have a series called MS Views Now, okay, where we have a patient leader that interviews other patient leaders around the country, okay, and then we also have me, who works with many of the healthcare neurologists that we have, the MS neurologists, and we do different programs with them as well, bringing them up to date, bringing you all up to date on what's being found out about multiple sclerosis and COVID, okay, as the primary topic of each of those programs. And I want to thank everybody for being here tonight. Again, I want to thank Jeff for everything he did. He did a phenomenal job. Wish we had more time, but tonight we don't, okay? And we'll just work on it and hope to bring you all that much more knowledge that much sooner, okay? So, Jeff, would you like to say anything else?
Yep, I do. Stay active, do more, be a leader, and lead by example. Wear your mask and wash your hands. Thank you.
Okay, great. Everybody, thank you very much for being here. And again, have a great night. Be safe. And remember, definitely, okay, you cannot social distance. Wear a mask, because if you do, you will be protected and you will be protecting others around you, okay? Just do it and make sure you take care of yourself. Wash your hands and use sanitizer, okay? Thank you. Have a great night, everybody. Be well.